Hi everyone, today we'll be discussing spoon-shaped nails. So what are we talking about here? It's a deformity of the nails where the central portion of the nail is depressed and the lateral edges of the nail are elevated, which gives an appearance of a spoon shape to the entire nail. This is medically known as koilonychia. And if we break it down, we have koilo means hollow, onyx refers to nail, and ia refers to condition. And as its name implies, the spooning is typically such as a water droplet may be placed and held in the depression within the nail. Koilonychia usually develops on fingernails, but it can occur in the toenails. Also, it may affect just one of the nails, a few of them, or all of them. Spooning of the nails can occur for different reasons that can be divided into congenital, acquired, and idiopathic, knowing that most cases are acquired. Let's start with acquired koilonychia. In this case, spooning of the nails is associated with several acquired disorders, and it's very likely to notice other symptoms beside the spoon shape of the nails. And the most common disorder is iron deficiency anemia. This is when you have too little iron in the body. And there are many reasons why a person might become deficient in iron. It could be because you're not consuming enough iron, or because there is an increased demand in iron as a response to certain body changes, such as in pregnancy and growth spurts in children and adolescents. Another reason you may become deficient in iron is when you lose too much iron. This happens in different bleeding scenarios, such as heavy periods, injury, gastrointestinal bleeding itself can be caused by diverse conditions, such as intestinal worms and gastrointestinal cancers. Additionally, you may have too little iron because your body can't absorb iron, and this can be caused by many conditions, such as celiac disease, inflammatory bowel disease, in some forms of gastrointestinal surgeries. Also, if you're taking medicines to lower stomach acid, they can affect your body's ability to absorb iron. In some cases, nail spooning may be caused by iron overload that could be due to an inherited condition named hemochromatosis or could result from blood transfusion or iron supplementation. In addition, drinking too much alcohol may lead to nail spooning because it affects iron metabolism. It can either reduce your iron levels leading to iron deficiency anemia or make your iron levels go up leading to iron overload as well. Next, koilonychia may be the presenting sign in a condition called Plummer-Vinson syndrome. It's a rare entity characterized by three features: iron deficiency anemia, difficulty swallowing, medically named dysphagia, and esophageal web. Also, vitamins, minerals, and protein deficiencies caused by malnutrition, poor nutrition, or eating disorders can lead to spoon-shaped nails. Trauma or injury to the nail can cause spooning as well, including excessive picking, biting, and rubbing of the nails, also tight-fitting shoes, and finger sucking in little kids, etc. Next, we have occupational exposure. Spooning of the nails may be seen in certain occupations where the individual is exposed to certain chemicals, such as ammonium thioglycolate, petroleum-based solvents, or lye, known as potassium hydroxide. In addition, koilonychia has been observed in individuals living at high altitude for decades. It's because there is less oxygen at higher altitudes, and as a compensatory mechanism, the body produces extra red blood cells, and to be able to do that, it needs more iron, and this can leave the body short of iron over time, which can lead to koilonychia. Moreover, spooning of the nails can be a side effect of chemotherapeutic drugs or radiation treatment. Also, koilonychia can be associated with endocrine disorders such as thyroid disease, diabetes, and acromegaly, which is a condition caused by excessive production of growth hormone. Furthermore, koilonychia can be observed in chronic diseases where there is chronic inflammatory state. As the body is not able to use the available iron in such circumstances, it's because one of the inflammation markers that increases in blood when there is chronic inflammation is hepcidin, and what it does is lack iron in its storage sites, so it cannot be used, and the body thinks there is sort of iron deficiency anemia, which can lead to spooning of the nails. Such conditions may include chronic infections, some heart diseases, cancer or malignancies, autoimmune diseases such as lichen planus, psoriasis, lupus, Raynaud's disease, some alopecia areata cases, and so on. Also, koilonychia can be one of the nail changes that can be seen in patients with chronic renal failure or undergoing hemodialysis. The following disorder is carpal tunnel syndrome, which is a condition that causes numbness and tingling in the hand and arm because of pinched nerve in the wrist. Carpal tunnel syndrome is frequently accompanied by various nail changes, and one of them is koilonychia. These changes are usually limited to the index and major fingernails. Now let's move on to idiopathic koilonychia. This is the second most common form. In this case, the spooning of the nails arises spontaneously in healthy individuals, and the diagnosis may be assumed after excluding all other possible causes. And within this entity, I'd like to bring your attention to a normal variant that is seen in most all babies and young children. It's the isolated idiopathic physiological koilonychia in infants and toddlers, brief in young kids. This is completely a normal condition observed, especially on the big toenails. It's temporary and spontaneously goes away on its own in a matter of a couple of years, usually after the age of 9. And the last category is congenital koilonychia. It's the least common form, and in this entity we have familial or hereditary koilonychia, which is a rare genetic disease inherited in an autosomal dominant manner. This means one copy of the mutated gene is enough to exhibit the condition. It may affect only a few nails or most of the nails. The next possibility is that koilonychia can be one of the nail abnormalities seen in certain rare congenital genetic disorders such as dyskeratosis congenita, ectodermal dysplasia, and nail patella syndrome. With that being said, how to treat koilonychia? If the spooning of the nails is caused by an illness or a specific condition, then treating or managing the underlying condition is the best way to help resolve this deformity. If the cause happens to be either idiopathic or hereditary, there is no effective treatment available. However, taking steps to improve your overall health and following tips for healthy nails will definitely help deal with the condition. Okay guys, we've reached the end of our topic today. Thank you for watching.